Well, welcome everyone. My name is Jay Otto, and I'm a researcher for the Center for Health and Safety Culture. And I, along with several other members of the center, were involved in this project on guidance on messaging to avoid psychological reactance and address moral disengagement. I'm going to be presenting today, but some key players from the center who did a lot of work on this project were Carrie Finley, Anne-Marie McMahill, and Jamie Arpin. So I want to acknowledge those folks as well. Just a little bit about the project. The sponsor of this project was the Traffic Safety Culture Transportation Pooled Fund Program. That's administered by Sue Sillick at the Montana Department of Transportation and has a number of participating states. So all of these states participated in funding this pooled fund, and then the pooled fund was the sponsor of the project. If you're interested in joining the pooled fund or learning more about it, you can reach out and email Sue, or you can visit the website page, and you'll see this page coming up several times. You can also Google it. Sometimes it's easier to find it that way. But if you look for the Transportation Pooled Fund on Traffic Safety Culture, it'll pop up. A little bit about Webex. I think everybody's gotten better at their virtual technologies. Webex is maybe slightly different than the other ones. There's a chat window that you should be able to access on a panel. That's how we'll do a lot of communication today. So feel free to enter anything you want into the chat window. It could be a question on the presentation. It could be a comment. Also, if you're having any trouble with the technology, you can use that as well. I've got Karen G, who helps us on all these projects, as well as Kelly Green, are also looking at the chat, so they can help answer those questions. I can see the chat as well. So I may answer your question as we're going, or I may keep it to the end when we have an opportunity to address questions. If for some reason your audio has trouble during the session, you can click on those three dots at the bottom and then click on the Connect Audio, and you can switch it to a mode where it will call your phone. And so you can access it over your phone, or as I can see, many of you have just used voice over internet, which is fine as well. But feel free, if something goes wrong, to reconnect with those three dots. Today's session is being recorded and will be available in the future from our website, as well as from MDT's site, if you wanted to listen to parts of it again, or you wanted to share parts of it with somebody else. Just briefly about the Center for Health and Safety Culture. So we do a variety of different kinds of work, all looking at the intersection of how shared values and beliefs or culture influence a variety of decisions that impact health and safety. We do research. All of our research tends to be very applied. So we're working with organizations to move the needle on specific issues. We also think it's extremely important to bring what we learn out to the field. So we also do a lot of training and even provide guidance. If you're ever interested in doing a project around health and safety and a cultural lens, feel free to reach out. We'd love to explore that opportunity with you. We are located at Montana State University in Bozeman, Montana. So we principally work in 4 areas. We do a lot of work in traffic safety historically, and we continue to do a lot of work around the prevention of the misuse of substances. We've done some work around domestic violence, interpersonal violence, and child well-being and child maltreatment. And of course, these issues intersect. We know that the misuse of substances is a leading contributing factor to traffic safety issues. We know that child well-being, child maltreatment, adverse childhood experiences can influence later misuse of substances. So all these are tied together, and we really like working in these different domains and looking at how we can really connect the dots between them, and in particular, how we can apply a similar framework, what we call the positive culture framework, to address these complex issues. So quick question to get you engaged. Find your chat window. If you could put in your chat window, what percentage of people you think in your state use a seatbelt? So put your answer in the chat window. You can include the name of your state if you want, or you don't have to, but go ahead and just put the percentage of people that you think in your state use a seatbelt. All right, so we got different numbers coming in: 87, 86, 85, 92, 80, 89, mid-low 80s, 90s, 85, 75, 90. So a variety of different levels, but all upwards, well above 50%, which is good. but we still have a lot of work to do. And this was sort of the beginning of this project. Nationally, one of the latest seatbelt studies showed we were at about 90% wearing a seatbelt, about 10% were not. Now that varies by state. It also varies by urban and rural areas, although actually in the last national study, the gap between urban and rural areas really reduced, so they were getting closer. But let's say it's on the order of that with some variety. If we also look at a behavior like speeding, or really we'll be looking at aggressive driving, but just at the speeding numbers, we've got about 18% of the population back in a study in 2015 were exceeding the speed limit by more than 10 miles per hour. So one of the things we can observe is that actually many people are wearing a seatbelt and are not speeding. So we're getting down to that smaller group of folks who are still engaging in risky behaviors, either not wearing a seatbelt or aggressive driving. And that causes a lot of negative consequences to themselves and others, right? We know about a third of fatals involve unrestrained occupants. About a third of fatals may involve speeding, about a third involve impaired, and of course they overlap. But the question we had is there anything different about this smaller group that is still engaging in these risky behaviors? Is it appropriate to treat them just like we treated the 90% who are wearing a seatbelt? Or might there be some conditions or factors or things we need to be wary of, and perhaps we need to shift some of our thinking? So in particular, the purpose of this project was to see if psychological reactance and moral disengagement were more prevalent among drivers who never or rarely use a seatbelt or who drive aggressively compared to people who always wear a seatbelt or rarely or never drive aggressively. Like, is there something about this last group in terms of psychological reactance or moral disengagement that might make us say, we need to approach this a little bit differently? And if so, what might be some potential messaging that we could use to grow protective behaviors and reduce risky behaviors, while at the same time minimizing reactance and maybe overcome moral disengagement? So that was the big thrust of the research project. What we're going to do here today is, first, we need a little bit of background. We're going to define what we mean by psychological reactance and moral disengagement, talk a little bit about how we sought to measure those, talk a little bit about what we learned from some survey works with individuals, what we learned testing messages, and then talk a little bit about resources, and hopefully have a chance at some time at the end for some questions. Feel free to also text in or chat in questions during. I'll keep an eye on it. As I said before, I might answer them on the fly, or I might keep them until the end. So let's first talk about, what do we mean by psychological reactance? Well, psychological reactance occurs when an individual feels their freedom or ability to choose is threatened. Now, that threat could be by something that somebody says or is conveyed in a message. It could be because a rule has been established and they've been told to follow the rule, or a policy or a law. And sometimes people react to this by seeking to reinstate or restore some sense of their freedom. So what they might do is just discount the information. Like, if you've conveyed information and they feel that information may threaten their freedom to choose, they may just say, well, that's just wrong, or you're lying, or you made that up, or it's not true. In some cases, they may even do the opposite. The best example, and this is a true story, I heard of this. We were doing some work in a state rural community, and a man in the group said, the day our state passed a primary seatbelt law was the last day I wore my seatbelt. So just pure psychological reactance. I mean, he had been wearing his seatbelt before, but because they made it a law, he was responding by saying, I'm going to do the exact opposite. So, like, the perfect example of psychological reactance. All right, just to get our heads around this, put in the chat window, can you think of any contexts or situations besides traffic safety where you think psychological reactance may play a role, where people may not be listening or may be pushing back to something because they feel like their freedom or their ability to choose has been threatened. What do you think? Yeah, masking, right? We're having a lot of conversations about wearing a mask, even about aspects of getting a vaccine. So, I mean, this is front and center in a lot of conversations. And I can sort of see on vaccines, right? I want to, maybe I'm concerned, I'm putting something in my body. I'd want to look at the information. I'd want to make sure it was studied. But, when you think about masking, it's a pretty low risk behavior, right? There's some things that, it bothers people, maybe triggers asthma or something. I think that's maybe low, but it's that feeling of being told to do it. And so we have folks pushing back. So we can see this coming up in a lot of different settings. And as you start to do your work, whether it's around traffic safety or other things, it's really valuable to start thinking, I wonder if this is triggering psychological reactance amongst others, and what then I might do about it. All right, so there are a couple different ways to assess psychological reactance. One is to view it as a trait or something that's sort of inherent in a person, maybe a part of their personality. And there have been a number of scales that have been developed to assess that. And we used Hong's psychological reactance scale. So this is one that's been validated in a couple different settings. Sometimes this is also called sort of proneness to psychological reactance. So it doesn't ask anything in particular context. It just asks some general questions of a person. How they score on that scale would determine their proneness to psychological reactance. Another way is to create a situation like a hypothetical or give people information or something like that, and then assess their reaction. And this is called situational reactance. And you're looking for a perception of threat. Do they feel threatened by it? You're looking for an emotional reaction. Often anger is one that you're looking for. Now, the other topic that we explored is moral disengagement. And this is separate. It could overlap with psychological reactance, but it's really viewed as a separate issue. And moral disengagement occurs when an individual willingly disengages from their normal standards, like their normal moral standards, and they override their own self-regulatory processes. And they might act very contrary to what is their normal everyday code of behavior. And they would not have a sense of guilt or regret. And you can see this sometimes in people when they get in a car, like right there, or a vehicle. They're like really calm, easygoing folks, but for some reason when they change when they get in their vehicle, and whether what's going on, but they can sort of lose sense of some of their standards and behave very differently. They'd say things in their car about other drivers that they never say to them face to face, or they wouldn't even say to them if they were outside of their vehicle. So we wanted to see if moral disengagement was going on. Moral disengagement can appear in lots of different ways, but basically it's about justifying unacceptable behavior. And potentially you might do some sort of moral justification where you say, well, look, it's okay for me to speed because I'm not going to hurt anybody. So it's not really dangerous. It's not a bad thing because I won't crash. I'm a better than average driver, right? Or we might have an advantageous comparison where we sort of compare the behavior that we're engaging in with an even worse behavior. And we say like, oh, I might speed, but at least I don't text and drive. Like those people are really dangerous, but speeding is not that dangerous. We may also use euphemistic labeling for what we're doing. So instead of saying like, oh, I'm tailgating somebody, it's like, no, I'm just hurrying them along. I'm trying to encourage them to go faster. I'm not tailgating. We could also displace responsibility. We don't have a primary seatbelt law, so I don't have to wear my seatbelt. Like it's not my responsibility. If it really wanted me to do it, somebody would make it a primary law. So there are actually multiple ways that people can sort of disengage morally. This is developed by Alberto Bandera, and he looked at all these different mechanisms. So you can actually ask a series of questions aligned around each one of these areas or ways that people morally disengage and see how much people agree or disagree with those. And so that's what we did, is we came up with a number of different statements following each one of these mechanisms for moral disengagement. We did some pilot testing just to see how those resonated with folks. We narrowed down the list a little bit, but that was a way that we were able to determine whether moral disengagement was going on with seatbelt use or aggressive driving. Can you think of any examples or situations besides traffic safety where moral disengagement may be going on? It's a little bit harder to think about, but can you think of any of those kind of context or situations? Just put those in the chat box. A question that came up on psychological reactance, is it more prevalent in teens? Absolutely. Like teens are trying to assert their own independence, so they're very psychologically reactant. So that's where you can often see it, and it manifests very well. So stealing food because you're hungry. So right, it could be shoplifting, littering, aspects of even doing things on or saying things on Facebook. Yeah, sort of different areas. So all of those, when a player rationalizes harm, deliberately fouling somebody and then rationalizing that behavior. Another example where it came up big time was in the 2008 financial crisis. There were a huge number of people who were engaged in selling what turned out to be really worthless financial instruments. And sort of when you ask them, do you think this has value? It's sort of, well, no, but that's what everybody's doing. And there's this huge moral disengagement that occurred amongst lots of folks and just got caught up in it. And it's like they look back afterwards and are like, my gosh, yeah, this was just crazy. We were selling stuff that had no value. We were just insuring things that should have never been insured and grading them as high grades when they shouldn't have been, and just got caught up and lost all sight of that. So it's a process that can definitely go on. And it's one that we want to be wary of as we're starting to shift or address people's behavior. All right. So how did we go about doing this? Well, the first thing we did is we wanted to test our hypothesis whether psychological reactance and moral disengagement were more prevalent. So we did a round of surveys, and we developed surveys to assess both reactance and moral disengagement, both in the context of seatbelts and aggressive driving. We did those two things separately. So those were two separate surveys. So these are going on in the research project in parallel, but they're completely different populations. We also used a behavioral model to identify beliefs associated with either wearing a seatbelt or aggressive driving, because we knew we were going to ultimately want to create some messages, and we wanted to ground those messages in a good theoretical model, a good behavioral model to say, okay, what kind of beliefs do we want to grow to increase seatbelt use or decrease aggressive driving while not trying to trigger psychological reactance or trying to overcome moral disengagement. So sort of all that was going on at the same time. We then recruited participants online. We used Qualtrics, which is a purchase panel provider that we use. And they reached out across the country. I think we had people from 48 states participate. And this was not a representative sample, because if we used a representative sample, only about 10% of those people would not be wearing a seatbelt. And that was too small for our study. We need a lot of people who were not wearing their seatbelt. So we actually were screening based on seatbelt use. And we wanted about half of the sample to say they usually or always wore a seatbelt. And then we wanted about half the sample to say they usually or never wore a seatbelt. So we had to screen out a lot of people who usually or wore a seatbelt because the quota was filled. And we had to keep searching and searching for those folks who rarely or never wore a seatbelt until we got enough numbers up. So we had about 581 people participate in the first survey. We did the exact same style with aggressive driving. For aggressive driving, we defined it as following too closely, speeding, which was more than 10 miles per hour in various posted limits, and excessive passing. So it was beyond just speeding. It was also those other behaviors of following too closely and excessive passing. For that one, we had about 750 folks participate. Then what we did is we conducted various analyses to compare the two groups, the group that always did the behavior and the group that never did the behavior, to see if we could see any differences. Here's the behavioral model we used to identify the beliefs we wanted to grow. Really, we wanted to measure all the beliefs in the green, behavioral beliefs, normative beliefs, and control beliefs, to see how those differed amongst the two groups and what beliefs we might want to try to grow in future messaging. So what we started to find was that those who rarely or never used a seatbelt did exhibit more situational psychological reactance. So we gave them 2 messages about seatbelt use, which were intentionally designed to create sort of psychological reactance. They were very sort of pushy and threatening. And what we found is that those who never or rarely used a seatbelt were more likely to have a psychological reactant response to those than people who usually or always wore their seatbelt. The effect size was small. It was not huge, but it was definitely statistically significant. But it was, on the small side. We also found that they exhibited more moral disengagement than people who usually or always use the seatbelt. And the effect size there was a little bit larger. That was about a moderate effect size. We did not find any differences in trait or proneness psychological reactance. So it did not appear that these folks were just typically prone to psychological reactance. They seem to be situationally reactant around the topic of seatbelts. For aggressive driving, we found that those who were frequently drove aggressively did exhibit more proneness and situational psychological reactance. These folks did have the trait psychological reactance. It was sort of just a part of their personality or their trait. This effect size was larger. It was more of a moderate effect size. And they did exhibit more moral disengagement. So we saw both things occurring in both populations, but it was more pronounced in the aggressive driving. So this led us, okay, so we're starting to see some of this reactance going on. We also learned different kinds of beliefs that we wanted to grow. And this led to the next phase where we wanted to then test some messages, all the while seeing if we could sort of keep psychological reactance down. So we developed surveys to test reactions to various messages. And then we assessed the perception of the strength and effectiveness of the messages. So we had people respond how strong they thought the message was and whether they thought it was effective. We then went through a similar recruiting process where we screened in people who usually or always or rarely or never use the seatbelt, likewise with aggressive. You can see our numbers are lower here. We actually did the seatbelt one twice. And I'll talk a little bit about later why our numbers were lower. We then conducted some analyses to see how they responded to these messages. In particular, we were looking at their perception of threat from the message, their emotional reaction to make them angry, and their perception of effectiveness, and then compared it amongst the 2 groups. Here is an example of one of the messages. We didn't really design this like to be a billboard or radio message. It was really just sort of a concept. So if this was actually to go to production, it would, I'm not exactly sure what it would look like. But here, I'll just read it to you. We play important roles in the lives of many people. We are wives, husbands, partners, girlfriends, boyfriends, fathers, and mothers. And we are good friends. We are people that can be counted on. Who are the important people who count on you in their life? What would it be like to choose to always use a seatbelt for them? Did you know most people choose to protect themselves by always using a seatbelt? And many people use a seatbelt for someone else, even if others in the vehicle are not. Who might you use a seatbelt for? On the right-hand side are some of the reasons behind the languaging. We were really trying to connect to a role with others. So this is less about seatbelts and actually more about relationship, which is trying to diffuse the reactance. It was the importance of protecting yourself coming out. That's some of the stuff we saw from the behavioral model. We wanted to get the norm in there that most people use a seatbelt. That was misperceived by people who didn't wear a seatbelt. We had a lot of choice language. We didn't want to tell people to do something. We wanted to create a sense of choice. That's very important to minimize reactance and create a sense that they're in control. And we tried to use a lot of questions to meet them where they are and not necessarily telling them or making some demand on them. So that's just an example of the kind of message we brought out and had them read and then respond to. So what we found, we tested 3 messages against a control message. So we kept the same control message that we had used on the first phase of surveys that we knew sort of elicited reactance. And we wanted one control message and one new message so they had something to compare against. And then we would compare their reactions to the 2 messages. And then we randomly assigned the people who took the survey to test one message and one control. So we had 3 groups because we were testing 3 messages, and they were always testing one of our trial messages against the control message. We could not find any messages that sort of stood out from our 3, even that radically stood out from the control message. It was quite perplexing, and we really sliced it and diced it a lot of different ways using a lot of different analytical techniques, but really one would be a little bit better here on this aspect, a little bit worse on this aspect, but nothing really stood out. Now, we have to put the context here. This was done in the fall of 2020, sort of the worst time to be doing this, some of this research. We had started this project in the fall of 2019. The pandemic hit. We went into lockdown right when we were getting ready to start phase 2 surveys. So everything about driving was totally out of whack. So we elected to pause and delay phase 2 until the fall. But then in the fall, we really needed to get it going. But then we ran into problems recruiting participants because of the election that was going on. So there was a whole lot of survey work that was going on. And Qualtrics was saying, look, we are flooded with surveys and people are getting surveyed to death. We're having trouble with getting people to participate. And everything was also still out of whack and even going more out of whack because we were sort of having that second wave of COVID. So things were a challenge. Our numbers that we wanted to participate were not that high. And that really limited our statistical ability to sort of see difference. So it was just a challenging time to do some of this work, a challenging time to talk about sort of traffic behaviors because everything was out of whack. Something we added to the work was to think about stages of change. Now, if you're familiar with misuse of substances or treatment prevention, treatment strategies where we're trying to intervene and change somebody's behavior who might be suffering from addiction and other things around the misuse of substances. There's been some work to look at stages of change. And it's this recognition that people don't just suddenly change their mind and suddenly go from doing something to not doing it, or from never doing something to doing it all the time. They go through these stages of change. So when we talked to one of our consultants on our team, she really recommended, well, don't treat everybody the same. Try to assess where they might be in a stage of change thinking on seatbelt use or aggressive driving, because that might really inform you. And honestly, somebody who's really not going to change at all, it's really hard to shift them with a message. So let's look at the stages of change. So these are the classic stages of change. Somebody's in pre-contemplation. They're not intending to take action in the near future. Like they're not even thinking about it. They're not even contemplating it. They're just not going there. Contemplation are folks who, well, they've actually started to think about it, and they might be intending to change in the near future. Preparation, they're actually taking some actions to change. Action, they're actually moving towards changing. Maintenance, they're trying to sustain the change that they've made. And termination, like they've got the new behavior down. They don't need to think about it. It's almost become a habit or whatever. They're not worried about reverting back. So we adapted these ideas. And on our second phase 2 of surveys, we added a stage of change question to see sort of where are folks in their thinking about maybe wearing a seatbelt or maybe not driving aggressively. And it was interesting. So for seatbelts, about 1 in 5 said, I don't use a seatbelt and I've decided I never will use one. So that's a chunk of folks who it is highly unlikely we will shift by using a message. Like even sort of counseling or intense one-on-one work may not shift them. They're pretty committed to not changing their behavior. So it's important to sort of recognize that and sort of say, well, maybe I'm not trying to reach that group with the message, but I'm trying to reach others, because 1 in 5 was there, which meant that 4 out of 5 were not there. So you can see about 40% said, I don't currently use a seatbelt and I don't really think about it. but they didn't say they were committed to not changing their mind. So there's a little wiggle room there. And about a third said, I don't currently use a seatbelt, but sometimes I think about it. So now here's a group that we could maybe really reach out to. Like they're starting to think about it. Let's help them think about it more. And then you can see, small percentage who are further up. And this was just amongst the people who indicated they never or rarely wore a seatbelt. So this gave us some insights. One, there are definitely some folks who were potentially were able to shift. And there's some folks who it's just going to be really hard to shift. And most likely with messaging, we're not going to pull it off. When we looked at aggressive driving, that group sort of in the pre-contemplation or sort of committing not to change was larger. It was about half the folks. So about 54% said, yeah, I currently engage in these behaviors and I've decided I will continue to do them. And that's, speeding, potentially passing excessively, and driving very close to others. But it also meant, slightly less than half of the people maybe were considering changing. So there was some opportunity there. So this really helped us because then we could look at different subpopulations within those people who responded to our messages and see if, based on where they were in their stage of change, did they react differently to the messages? Well, unfortunately, because of our smaller sample sizes, we couldn't see any differences there. Maybe there are no differences in how they reacted, but also our numbers were just really getting small here. So the differences would have had to have been really big for us to see them statistically significantly. So that was a limitation. But it was an interesting insight from the project that we gained that we maybe don't want to treat everybody who's not wearing a seatbelt the same. Some of them are more willing maybe to shift their thinking than others. And yes, we're going to have to think about psychological reactance and moral disengagement as we move forward. So some key takeaways. Here were some potential message content ideas to increase seatbelt use. And don't worry about writing any of this down. This is all in some resources that I'm going to share at the end. So all these ideas are on short little 2-pagers that you can download and have all this content. But one is sort of putting out that idea that using seatbelts is a way to protect ourselves. It seems obvious, but it's this idea of protection and protecting ourselves and others may be a way to go. That often we saw some notion that using seatbelts sets a good example for our children. So again, that's an idea that focuses not on you wearing a seatbelt for you, but maybe you wearing a seatbelt for somebody else, which might be an interesting strategy for folks who don't wear a seatbelt. Like they may not ever do it for themselves, but they may do it for somebody else. Getting that idea still out that you're less likely to be seriously injured or killed if you always use a seatbelt. There are a few folks who believe that seatbelts can trap you. We want to overcome that misperception. There's people who misperceive the use of seatbelts, both within their community and at their workplace. So just the need to normalize, hey, most people are wearing a seatbelt. Like, the people who weren't wearing a seatbelt really had some misperceptions there. It was also clear that family and workplace rules could potentially increase use. So encouraging families to have a rule and workplaces to clearly establish and enforce a rule could help. And that maybe people choose to use a seatbelt because they care about others and they recognize that their own injury or death would negatively impact others. So it's not like, again, you're doing it for you. You're kind of doing it because of the other people in your life. And that may be a way to diffuse some of the reactance, overcome some of the moral disengagement, and aligned with some of the things we saw from the behavioral model. Progressive driving, we really wanted to increase and highlight the fact that this does increase the likelihood of crash. Some folks were like, no, it really doesn't. But it really does. And that might just be a crash. It could be injury. It could be death. And it could be financial loss. Like you could have to pay a lot or you could have your insurance go up. So not always resolving it to death, but including other negative outcomes as well. There's also a misperception. I think speeding really doesn't save that much time. If you're driving a short distance and you're speeding, you're going to get there a few seconds earlier, but you really increase the risk during that time. That people close to you may consider aggressive driving unacceptable. And then we want to empower those other folks to sort of speak up and say, like, your driving is just, this isn't acceptable, and create that localized social pressure. So that message is coming from somebody close to them as opposed to the government or from a law enforcement officer whom they may very much act reactantly to. Overcoming the misperception of the norm. Most people in your community or workplace don't drive aggressively. Speeding, sometimes we found that people indicated they were more likely to speed if they were late. So helping them overcome there, like, it's not going to get you there much sooner, and it could result in a crash. So if you're late, maybe just accept that you're going to be late and don't increase your crash risk. And then helping them get their context for their behavior out of their vehicle. Like, would you behave this way if you were in the grocery store? If you've ever seen it, Clackamas County, Joe Merrick made this great commercial of people in a grocery store. Like, would you drive your grocery cart the way you drive on the highway? Probably not. And you might be really gracious in those circumstances. Well, why aren't you gracious on the road as well? So just trying to get people that moral disengagement to connect to a different context. Messages focused on individuals who rarely or never use a seatbelt, or who usually or always drive aggressively, really may benefit from using language and designs that intentionally seek to reduce psychological reactance and moral disengagement. So if you're not familiar with psychological reactance or moral disengagement, and you're somebody who's communicating on these things, you may want to learn more about them and think about ways to reduce that reactance and increase sort of moral engagement or reduce moral disengagement. And we'll give some of those ideas right now. One is to really think about message style. So you want to consider the language that you're using and maybe test it with folks and look at sort of, does this feel threatening? Does this create a sense of anger? Do people perceive this as taking away freedoms? Do I need to add more choice? Do I need to add more questioning? Also, sometimes narrative or storytelling can be really helpful, as opposed to just telling people facts. Having it come through a story or somebody giving their own sort of testimony or narration can help quiet the reactance. How is the message framed? What are you doing around your framing? A frame, like a piece of artwork, has a frame around it, and that frame will really influence how you see the artwork. Well, likewise, how we frame our messages really will create the context in which people will hear them. If you're not familiar with framing, the CDC has a great guide. You can Google this, a framing guide for communicating about injury. It talks about all sorts of just good ideas to think about when you're framing different messages, particularly around health and safety. So probably some of you are very much thinking about your framing. Maybe some of you are thinking about it less, but really thinking about your framing, and then how am I designing my framing to decrease reactance? Message content. So obviously this is really important. So if you can offer choices to people, this can really help decrease reactance. So somebody had pointed out before, like psychological reactance is typical amongst teenagers. Absolutely. So you go to your teenager and you say, you have to do your homework right now. The teenager says, no, and walks outside and plays basketball or something, does the opposite. So instead of creating that reactance, you can sort of say, look, we need to get homework done tonight. You can do it now, or you can do it after, you do something else for half an hour, or after dinner. Which would you choose? So the homework's still going to get done, but you're giving them some degree of control, which decreases the reactance. And you can do that in your messaging. You can sort of give people some degree of choice, even though you're sort of leading them towards a safer behavior. You can use mechanisms to get them to think or re-engage their own social regulation. This is particularly important around moral disengagement. So sort of, hey, pause and think for a minute. Like, is this really who you are? Is this something you'd really do? Think about this for a second. Try to create empathy and focusing on pro-social behaviors, things which to the benefit of others. That can really get people reconnected to sort of who they are and get them to a place of like, oh, wait, maybe this isn't a good idea. Or no, I wouldn't do this. What am I doing? and getting them to think about others and not getting caught up in the moment. Really try to grow their perspective taking. Can they see broader perspectives? Can they see it from more than one angle? How can they grow their own self-regulatory mechanisms? Like if you feel like yourself getting agitated while you're driving, what do you do about that? Can you take a few deep breaths? Can you think about something that calms you down? You can be in control of how you feel in these circumstances. You've got to take over and have some self-regulation there. And those are skills that can be practiced. Message delivery. Absolutely consider who's delivering the message, right? Is this a very authoritarian figure to whom somebody might have a lot of reactance? Do I want a law enforcement to deliver this message? Maybe I do, maybe I don't. Maybe that's going to trigger some reactance. Maybe I need another person bringing it up, or maybe I need somebody who really looks like the audience I'm doing to sort of do a narration or storytelling. So it's like from their own as opposed to from another entity. Do I want this to be branded about the state, or does it should be branded somebody else? So all these are things to think about in terms of who's delivering the message. All right, so that was a pretty quick whirlwind tour through the project. There's a pretty large final report that goes through the details. There's also an information sheet about ideas, messaging ideas around increasing seatbelt use, as well as addressing aggressive driving. There's also just a slightly larger, I think it's 3 or 4 page brief about some general message guidance, trying to quiet reactance and address moral disengagement. There's also a large summary poster. That's sort of something that might be used in a research setting. You could potentially print it out on a large sheet of paper and it kind of summarizes the whole project. But all of these are tools that you can download if you go to this link. This is on the Montana Department of Transportation, MDT's website. It's a little bit hard to find. It's easier to find if you just Google it. If you Google MDT traffic safety culture, you will pop up on the page. And then you just want to look for the project, which is about guidance on addressing psychological reactance and moral disengagement. On that page, you'll see all the pooled fund projects. Maybe there's another project you want to look at as well. But that's an easy way to find that page on MDT's website. It's just to Google traffic safety culture and MDT. So I'd encourage you to look at those resources. You might want to download those. Kelly Green's also put this link in the chat window. So if you want to click on it in your chat window, that's really helpful as well. Thanks, Kelly. We want to very much acknowledge the limitations here. So this project used correlation analyses. Correlation is necessary, but not sufficient to sort of establish causality. We did not do any experiments with people where we were able to seek to manipulate or change their beliefs and then assess changes in their behaviors. So what we can say is that these recommendations may result in behavior change, but we don't have concrete evidence of actual behavior change. It just wasn't in the design of this project. This project began prior to COVID. We paused during COVID, and then we resumed in the fall of 2020, which was a really tough time to restart this project. So there's just wonkiness going on about everybody and driving and the world and everything. And that was the context that the project was done in. It's hard to say what influence it had, but we certainly can't ignore it. If you have any questions, I'd encourage you to put them in the chat window. I can see the chat window. We can talk about some of those now. This was a really interesting project. COVID made it a lot harder. We just struggled recruiting the numbers we wanted, so that really limited us. We didn't see as much as we'd like to see in some of the messaging, but our numbers really got kind of small, and then we just had to sort of pull the plug because we were running out of time. And really, Qualtrics came back to us and said, "Look, guys, we can't find more folks to participate." But I think it raised some really interesting ideas. We definitely have the evidence that moral disengagement and psychological reactance is something we need to be considering with these two populations. And that I think is valuable just to start to inform how we might think about this work and think about approaching messaging around here. So I'm keeping my eye on the chat box. I don't see anything, but feel free to continue to chat in. I'll give you a little bit more information while maybe you're crafting a question or while those are coming in. Some upcoming webinars. Another project that was done by the pooled fund on traffic safety culture was looking at guidance to promote family rules and workplace policies to reduce cell phone use and in particular distracted driving and to promote engaged driving. So we look at two contexts. We looked at the family context and we looked at the workplace context. And both of those are really important contexts for which parents particularly could speak with their young drivers, and supervisors could speak with people that they supervise about being more engaged in driving, and in particular, less use of cell phones. So that webinar will be on Friday, September 24th. The times are listed there. You can go to our website, chscculture.org, to register for that. And so feel free to join us there. A question came in: were the participants from Montana or all over the US? Was there any geographic stratification? The participants were from all over the US. We had Qualtrics really try to reach out. So we had participants from 48 states. So pretty broad representation. It was just in the United States. We did not do any assessments to look at any kind of patterns amongst portions of the state. We did do a little bit of looking. We had people self-identified whether they considered their area as an urban area with a large population, a suburban area with a moderate population, or a rural area with a very low population. And we didn't really see a whole lot of patterns even there amongst those three different geographic groups. But it's really important to keep in mind that this was not a representative sample because we were really screening people to find people who did not usually wear their seatbelt or who often drove aggressively, because that was what we really wanted to look at. But we didn't really see any patterns. We didn't really see a whole lot of patterns on age, a little bit on gender, where males were more likely to engage in aggressive than females, but not a whole lot of patterns in terms of geography. But it was way beyond Montana. It was across the United States for sure. So good question. Some other current projects that are underway at the center right now on behalf of the pooled fund. We did a brief review, sort of a synthesis of existing literature on methods to change beliefs. Sort of how do beliefs get formed and how do we change beliefs? That's underway now. You can keep monitoring that by going to the website for the pooled fund, and you'll see the reports come out as they're done. That project will probably be done in about 6 months, and there'll be a webinar about that. And then we're doing a longer term project. Carrie Finley on our team is leading a project that's seeking to develop some resources and tools to reduce multi-risk driving behaviors. So we know that risky behaviors don't occur in isolation with drivers, right? You can see an overlap of not wearing a seatbelt, sometimes impaired, sometimes speeding, sometimes, aggressive, all those tied together. And so we wanted to look at, are there some strategies we could use to address those multi-risk driving behaviors? And this is a really exciting project because we're going to actually be able to do some experimental work. So we're going to actually recruit some individuals, do some intervention work, monitor them, see how their behaviors potentially change. So that's really exciting. It'll take a little bit longer for that, but it's exciting because we get to do some experimental work. And all these projects you can keep an eye on the pooled fund site. Another question came in: although limited by the pandemic, how do your results compare to other similar studies? So there have been some studies that looked at psychological reactance and a little bit on moral disengagement on aggressive driving. Some others have looked at that and seen similar patterns, that absolutely aggressive driving has been associated with psychological reactance and some aspects of moral disengagement. We did not see many other studies that had looked at psychological reactance among people who rarely or never wore a seatbelt. That seemed to be a gap in the literature. We looked for it, but we didn't really see it. There's some studies looking at just other characteristics of people who rarely or never use a seatbelt, but we didn't see psychological reactance or moral disengagement going on there. So that was interesting. Definitely the patterns that we saw in terms of responding to messages and different things were similar to some other folks, I think, that have looked at some aspects of messaging. The reviewer for this project, it was great, was a researcher at Cars Q, which is in Australia, Queensland. They do a lot of work on traffic safety in Australia, and they had done some work also looking at the intersection of aggressive driving and psychological reactance. We had actually done some previous pilot work looking at that as well. So that pattern has come up several times, but we hadn't seen as much existing literature on the seatbelt side. So that was interesting. Moral disengagement, another question. Moral disengagement seems related to cognitive dissonance. Are these interrelated concepts? So absolutely. Somebody who's starting to engage in moral disengagement might not be doing it very thoughtfully, like it's sort of incrementally, and they just sort of lose connection with different things. And so raising cognitive dissonance can absolutely be a strategy to seek to sort of re-engage them morally. So you suddenly start saying, so you were doing this when you're driving. Let's take your aggressive driving behavior. Let's put it in a different context. Like, would you do that if you were waiting in line for a restaurant? Would you like charge ahead and butt in front of somebody? Oh, you wouldn't. Huh. Well, why wouldn't you do it when you're waiting in a restaurant line? Oh, because you're very, courteous and you think about other people and you're very caring. But is that reflected? Are those values reflected when you're driving? So absolutely, cognitive dissonance can be a strategy to help sort of pull people away from that moral disengagement and sort of reconnect them. Sometimes I think the thought is with moral disengagement, it's sort of happening slowly and the cognitive dissonance doesn't occur on its own. Like and then it just gets into a habit and they've lost sense of that dissonance. So a strategy that seeks to raise that dissonance, maybe through some questions and other things, while at the same time not increasing reactance, could be a mechanism to move forward. So absolutely a great idea and certainly related, and thinking about raising cognitive dissonance as a strategy to overcome moral disengagement makes a lot of sense. So a good observation. Standard disclaimer from states and different entities working on this. So I won't read this out loud. Those of you who've worked on different transportation related will recognize that language. So just be mindful of that. There's also ways to get different forms of the documents for access. And if you're ever interested in following up on any of these issues or projects, feel free to reach out to us. And that's our website. You can also follow us. I think Kelly was just reminding me that there are some questions in the question box. So let me look at those as well. I had missed those. So do you have any advice about the repetition and frequency of different message variations? Since shorter messages are often more successful in social media, how often should we repeat the same message or mix up messages? For example, rotating messages which focus on role of others, choice language, and social norms in different ways. So that is a great question. That is a big question as well. What we do know from the research that's done on messaging strategies to change health-related behaviors is that dosage is one of the major limiting factors. So dosage, we consider dosage about media at the center involving three components. How much of the audience are you reaching? Like if you're trying to reach young adult males, what percentage of young adult males are you reaching with your messages? So that's one component of dosage. The next is frequency. How often are you reaching them with messages? And duration. How long, like over time, are you reaching them again and again and again? And so you want to think about all three of those components for messaging. And what we know is it takes an enormous amount of dosage to start to shift people's beliefs if messaging is your only tool. Nike didn't advertise once. Budweiser didn't advertise once, right? Apple didn't advertise once. You advertise a lot. So that is the hard part. And the research has shown that health-related campaigns often don't have the dosage to reach it. How often would I message? I would message as often as you could. When we've done strategies with very concentrated audience, like high school students, where they're in a school, or at least they used to be in a physical school. Hopefully they will be there more in the future. But we would seek to have messaging going on all the time, where messages were updated, several times a month. if you put a single message out or you put a single message up like a billboard or different kind of media, it turns into wallpaper relatively quickly. So you got to update things all the time. And then in experiments that we were doing, we would have those messages rotating monthly. We would seek to reach over 80% of the population, and it would take a couple of years before we would start to see belief change. So it takes a phenomenal amount of dosage. You will be absolutely sick of your messages when the audience is just starting to get it. So that's the hard part about communication. I think what we recognize at the center is that communication is one tool, but it's not the only tool. And often we think about it as a catalyst, that we're also connecting the dots with other tools like policies at workplaces, like family rules, like other forms of intervention and education. So we really span the whole social environment of the social ecology, and we're using messaging at the same time, but we're not relying on messaging to do it solely because it takes so much dosage. You've got to repeat the message many times. You can create the form and different language and different words, but it's a lot of repetition. Question, will this be recorded? Please send the link. Yes, this will be recorded. And I think we have a mechanism through the registration that we can send the link out to you. You can also visit that website, the Pooled Fund site, where the link will be posted. The link will also be posted on our website. So if you check back in a day or two, the link should be up. All of our websites all of our webinars on our website most of them are all recorded. So even past ones, you can go and look at those. And this one will be added to that list as well. Anything else coming up? All right, I think I'm pretty current. Kelly or Karen, jump in if I'm missing anything. We've got 2 minutes left. I really appreciate all of your time today. I appreciate all the work that you do. This is such important work. And a lot of these ideas overlap with the work that we need to do on COVID as well. So even in the COVID context, we all recognize psychological reactance is going on big time there, and there are important lessons that we can learn from these ideas to apply there as well. So with that, I wish you all well. Stay safe, wear your seatbelt, don't drive aggressively, and hopefully our paths will cross again soon. Take care.